Hello, Professor Bell and fellow classmates. My name is Roderick Johnson, and today I will discuss electronic health records and continuing quality improvement efforts, CQI, the benefits and the drawbacks that the electronic health records have on CQI efforts, and conclude whether or not the electronic health record is as beneficial to CQI efforts and the quality of patient care as is often asserted. First, let's start with some background on the genesis of the electronic health record. In 2009, the Health Information Technology for Economic and Clinical Health, HITECH Act, changed the face of healthcare forever. Chiefly, the primary purpose of the legislation was to encourage health providers to implement an electronic health record, EHR system, Minichimmy Column 2011. An EHR is defined as a longitudinal electronic record of patient health information generated by one or more encounters in any care delivery setting. Minichimmy Column 2011. Further, the HITECH Act required that these providers use the EHR technology in a meaningful way, or more simply put, a way that helped reduce institutional error and optimize the quality of patient care. Minichimmy Column 2011. Since 2008, the EHR use in healthcare organizations has increased from roughly 10% to nearly 76% in 2014, and the numbers are expected to increase until all medical data is contained in some form of digital software, saying 2016. It is asserted that the primary goal of a healthcare organization is that of quality improvement. The continuing and conscientious effort to optimize the experience of the patient is considered the chief most aspect of total quality. Goesch and Davis, 2010, page 182. EHRs have numerous benefits and drawbacks and can affect the aspects of quality efforts in a myriad of different ways. The following brief is an analysis of EHR use measured against continuing quality improvement. The EHR can provide a variety of benefits. Joseph M. Juran has been deemed one of the pioneers of total quality. Among his numerous principles, he developed what has become known as the Juran Trilogy, one of which is the teaching of quality improvement, or CQI. One of the four ascribed factors of CQI is the identification of areas in need of improvement and the actions taken in order to improve them. Goesch and Davis, 2010, page 19. At its inception, the EHR was expected to radically improve the quality of patient care. Minichimmy and Column 2011. The advantages of these systems include improvements in the quality of care, a reduction in medical errors, and improvements in patient-level measures that describe the appropriateness of care. Minichimmy Column 2011. One of the principal benefits of the EHR is that it provides a more thorough scope of care by making the data within the health record readily accessible to other healthcare providers who may come into contact with a patient. Health Science Channel 2015. The EHRs have also decreased the potential for confusion. Due to the majority of orders and prescriptions now being electronic, pharmacies, hospitals, and other doctors' offices no longer have to struggle through attempting to read the handwriting of other nurses, technologists, and physicians. Health Science Channel 2015. There has also been an increase in the efficiency of communication. Physicians are able to receive test results, radiologic images, and nurse notes immediately. Health Science Channel 2015. Not only does this make the work of the physician more efficient, but it also increases the overall likelihood of a positive outcome for the patient should there be a critical development. While the EHR has proven itself beneficial in a variety of ways, there have also been a number of pitfalls associated with the widespread implementation of electronic health records. From the beginning, the transition from paper records to that of electronic health records proved difficult. All existing paper records had to be computerized, and some systems of documentation did not integrate well with the software. Health Science Channel 2015. For example, in 2002, it took a small acute care hospital more than 7 years to implement their EHR technology at a price of nearly $19 million. Minichimmy Column 2011. In addition to the previously mentioned disadvantages, another shortcoming of the EHR are the costs incurred. Potential costs are not only the cost of the software itself, but factors such as ongoing maintenance costs, loss of revenue associated with temporary loss of productivity, and declines in revenue overall. Minichimmy Column 2011. Further, Minichimmy Column 2011 also assert that the yearly maintenance costs for an EHR system averaged roughly $8,000 per doctor per year at a given facility. Perhaps the most obvious drawback of an EHR system is that of the possible violation of private patient data. Minachimbi and Column, 2011. With paper records, the entire patient record was always in one place at one time. With the advent of EHRs, it is possible that a patient record could be accessed remotely at any time for any reason, whether work-related or not. All these factors can adversely affect the quality of patient care and the continuing efforts to improve it. So it begs the question, is it worth it? Is the EHR a help or a hindrance to the continuing quality improvement efforts of healthcare organizations? Kate Monica, writing for EHR Intelligence, seems to think that they can help more than they hurt if they are used in the correct way. Monica states that EHR systems need to be re-engineered as systems of engagement rather than systems of record-keeping to yield real improvements. Monica, 2018. Essentially, EHRs were originally designed exclusively for billing and record-keeping, but now that the needs of the software have evolved and the potential uses have been demonstrated, an overhaul is necessary. Monica, 2018. Such an overhaul can be achieved primarily through the utilization of AI, or predictive technology that tailors software to different providers and institutions. Monica, 2018. Such a coupling of AI technology and EHR software will project the quality of patient care into an entirely new sphere. Monica, 2018. Monica makes an interesting point with these claims. It is clear that the benefits of EHRs far overshadow the drawbacks and have, since their inception, served to promote the CQI agenda of medical institutions and have improved patient outcomes. Customer focus is external customers that define the quality of the product or service delivered. Goesch and Davis, 2010, page 10. In a medical organization, these customers are the patient and the service is an effective and high-quality treatment. By now altering and upgrading EHR technology to serve the unified agenda of CQI, medical organizations and their providers would be moving that much closer to their goals of increasing quality and unequivocally subscribing to the basic principle of CQI, which is a continuous, ongoing effort to improve quality regardless of previous achievements. While drawbacks such as potential compromising of a patient information, loss of productivity, and hospital disorganization during implementation, as well as exorbitant costs of software, it seems that the benefits are more promising. The potential to reduce medical error, further automate and produce more sophisticated patient care through AI technology, as well as the potential for a comprehensive and consolidated medical record, are benefits that are not to be taken for granted. To conclude, the benefits of the EHR provide a strong reinforcement to the CQI agenda and have the potential to increase its effects tenfold. Thank you.